get some analysis now from Dr. Swati Maheshwari. She's a senior internal medicine specialist and joins us from New Delhi. Doctor, why are we seeing such a severe second wave in India when it seemed like the country had managed to get the upper hand on the virus?
Absolutely, you're very right. Considering the first wave, we had controlled it very successfully. We had put down timely lockdowns and we had upgraded the existing health facilities that we had. But somewhere or the other, as you have seen with the pandemics which had happened in the future also, there is COVID fatigue that sets in into people, and not just into people, even the governments as well. So what we saw was that people really had overconfidence over the time the first wave ended. We thought we were immune to the virus and probably India would not see the rest of the virus as the other world saw. So somewhere or the other, people, had started getting complacent. They were not too worried about the virus as such, and we started our routine activities. And the other major factor was that we had these strains coming into India. So we had the other strains which were floating around in the world step into India. And over the time, even more strains grew here and they were brewing somewhere or the other. And suddenly there was an explosion, and all the people, you can see how India got impacted by the second wave because we are a very populous country. And once such kind of strains, which are very transmissible, set their foot here on our country, then it's very easy for them to spread like fire. So somewhere or the other, I think these were some factors which actually accumulated together, and that's why we are seeing right now a very sharp second wave, and right now we are really reeling under the pressure.
We've seen a number of patients die because of accidents or hospitals, at hospitals or oxygen shortages. Why are hospitals in India not fully equipped to handle the patients that they do have? And what does it say about the state of the health system there in India?
So I think since the time pandemic struck the world, India has been trying to upgrade its healthcare facilities. And last year it was on the priority for the government as well. And if you look at the budget that was released this year, we tried to pump in more money into the healthcare system. But yes, obviously these things take a while. And if you look at the magnitude of our country and the number of people that we have here, the healthcare infrastructure is not up to the mark. We still are not there considering the terms and the conditions that have been laid down by the WHO. So we don't fit into the standards still, but we are trying our best and we are trying to upgrade our facilities. And even the government has it on their priority cards. But as you know, it takes a while for all these healthcare infrastructure to come up. But still, we are trying to pull in best of our resources right now. The problem is that the numbers suddenly there was a sharp rise, and the hospitals started getting overwhelmed. They started spilling over, and that's why we saw the death rate also going up, because you also understand if people who require hospital services are not able to get the services, then we see a lot of them succumbing to their problems.
It's not just India. We're also seeing the number of coronavirus infections rising globally, but still less than 4% of the global population has been fully vaccinated. Is the world fighting a losing battle with the coronavirus at the moment?
See, we started the fastest vaccination drive here in India, and we also understood the fact that vaccination is key to control the coming waves as well, and even the second wave. For that matter, like the rest of the world, we also strategized the entire vaccination drive, and we also gave vaccination first to the healthcare workers and then the people who were above the age of 45 and who had comorbidities. One of the challenges that we faced here in India was vaccine hesitancy. Some people had apprehensions about the vaccine and they were not too willing to take the vaccine, though the government tried their best to kill their apprehensions and make them understand that the vaccine is very essential. Somewhere or the other, it's very sad that it is the second wave which made people realize that the importance of the vaccine. So we are trying our best right now, and we are trying to see how we can reach out to maximum population and even to COVID dense geographies, because India is a vast country and we have far flung areas, the rural areas where maximum population of India lives, and how we can cross these different geographical terrains and deliver the vaccines. That is one of the challenges, and the government is really looking at it, and also at the production of the vaccines, because we are 60% producer of the world, but we have a lot of business obligations to the other countries as well. So we are seeing how we can cater to domestic needs as well as the international market and do the best in both the markets.
All right, we'll leave it there. Dr. Swati Maheshwari in New Delhi. Thank you so much.